Portsmouth Regional Hospital in Portsmouth, New Hampshire. I want to welcome everybody to Facebook Live. Whether you're watching us live or watching us later, please feel free to leave any comments, any questions, and please feel free to share. So I'm really excited tonight. We're joined by Dr. Thomas King, one of the orthopedic surgeons here at Portsmouth Regional Hospital, and by Mr. Walfield, one of Dr. King's patients. So what I'd like to start with is I really want to learn more about your same-day surgery, your Avatar program, and just tell me a little bit about yourself and your practice.
Well, I'm an orthopedic surgeon. I've been in orthopedic surgery for over 30 years, and I've been at Portsmouth Regional Hospital for about 25 years. And I specialize in knees, hips, and shoulders. And I've had the opportunity to work with a lot of very great people at Portsmouth Hospital. I think that's really what this is about, is not me, but all of the people that I get a chance to work with. I think many of you know Kathy Levitt. She's a physician assistant who's worked with me for over 25 years, and she's a motivating force behind this. Sue Dumore is a physical therapist who runs Abilities Physical Therapy. She's been a motivating force. Liz Hugg is a nurse who worked with us for over 20 years on this. She's retired now, but she was wonderful. And I'll stop there naming people because I'm going to leave a million people out, and I really don't want to do that.
And so how about the same-day surgery in your Avatar program? I'm really excited to learn a lot more about that.
Well, I think Avatar is very different. It's really an approach that gives people finally what they want with total joint replacement, and that is less pain, fast recovery, and better function. And these three things are the new benchmark of success for total joint replacement. If you look at what we've been trying to achieve in total joint replacement for the last 10 years, all of the biomedical companies have been promising this, promising people that they would deliver on less pain, fast recovery, better function, but have failed to do so. And so Avatar, I think, is the answer to that.
Okay, and we're going to learn a lot more about that. But I also want to welcome one of Dr. King's patients, Mr. Walfield. So, Mr. Walfield, how did you end up here with Dr. King? And tell us about your experience. What brought you here?
Well, it was easy. 17 years ago, Dr. King put 2 knees in my wife, and to this day, 17 years later, there's never been a problem with him. So, why would I go anywhere else?
And so, tell us. So, 17 years ago, she had her knees done. You're feeling ready. You come back. So, tell us about your experience about coming here to see Dr. King and being here at Portsmouth.
Well, I was hurting pretty bad. I couldn't do the things I wanted to do, and it was time. So I came down here, and Dr. King introduced me to same-day surgery. I like that. I don't like hospital stays, so this was great. I'm coming in and going to get it done in one day and go home, and I did. I walked out of here in the afternoon, excuse me, no help. Got in my car, the wife took me home, got in the house, and got in bed onto a CPM machine, the best tool out there. I was in that 8 hours a day in the daytime, and I slept in it at night, 8 hours there too. This thing it was great. That's a fabulous machine. So from there, James, what do you want to hear?
So tell us about your recovery. Tell us, you talked about the CPM. Tell us about the recovery. How long, working with PT?
Okay. The next day when I got home, there was 3 people there, OT, a PT, and a visiting nurse. And they were great. Physical therapy for 2.5 weeks, I think it was. They worked you, gave you a good program to do when they were gone. OT followed my progress, how I was doing. In less than a week, I was walking outdoors. My first one was December 2nd. And this is wintertime. OT's got me outdoors walking. The nurses kept the vitals going. Pain, what pain? There was hardly any. The schedule Dr. King sent me home with, and the wife made a worksheet chart. She stuck right to every thing I was supposed to take. And the second week, it was down. I just wasn't taking what I did the first week. The third week, it was done. I wasn't taking any more at all. Pain was very minimal. No complaints. I drove myself to Health South. That's where Dr. King sent me for rehab. 2 weeks up there. I drove myself up there. They were great. Great therapists. Good people. Worked you hard, gave you a program, kept you on it. You did it at night and the weekends when you're home. And what else, James? What else?
I want to bring that back. It's really interesting. You said your wife came here and she's joined with us this evening. 17 years ago, and now you've got your knees done. So Dr. King, 17 years, what's changed?
I think that's the point. Everything's changed. If you look at the way, as I was mentioning, the way the biomedical companies approach this is they're going to try to tweak the surgery. They're going to try to sell us some kind of expensive technology, whether it's a computer navigation system or a robot or customized total knees or a new surgical approach. They're trying to sell that as changing the whole program. And the problem with that, it's a much too simplistic approach to total joint replacement. Total joint replacement is much more complex than that. It involves not just the surgery, of course that has to be done perfectly. We have to use the latest technology. But in addition, it involves anesthesia, medicine, nursing, pharmacy, physical therapy, occupational therapy. And within each one of these, you have many other components. So this is really like a complex recipe. There are a whole lot of ingredients. And it's kind of simplistic to think that if you change just one ingredient in a bad recipe, it's going to make it better. And if you have a great recipe, if you're missing one ingredient, if you're missing one of those components, it's just not going to come out right. So what Avatar does, it recognizes all of these very vital assets. And that's what Avatar is recognizing these assets and aligning them so they all work together. And it's about all of these people, not with something that's imposed from above, but all of these people working together to align the assets to accelerate recovery. And so literally everything has changed. The anesthesia has changed, the surgery has changed, rehabilitation's changed, pharmacy has changed. All of these things have been evolving over 20 years. So it's not a brand new idea, and it keeps evolving. It is not something that we can just have and have it stand still. We can't sell it to somebody else. No one else can buy it. It really is about all of these people working together and aligning the process so that we get a synergy. It works as a recipe. And I think that's the difference between what we did 17 years ago and what Lee has been able to experience.
That's pretty exciting. And I got to meet Mr. Walfield a little bit earlier, and he was telling me, but I want you to share with everybody on Facebook Live, you're an active guy. Tell everybody what you're doing after your knee surgery, because that blew me away.
Well, James, I got my life back. Before the knees, I was hurting. The things I like to do, I couldn't do. I couldn't bicycle. I couldn't hike anymore. Swimming was tough. Water skiing was out. I'll get to water skiing later. Snow skiing, motorcycling, snowmobiling. I couldn't hold my motorcycle up with my old knees because I was afraid of laying down a 1,000-pound bike on myself, plus my wife maybe. So anyways, after this, everything's back. It's great. I'm doing all those things I just mentioned. I had a second surgery here. That was January 11th. And 2 weeks later, after that surgery, I came here to see Dr. King, and he gave me the red light, green light to go to Florida with a prescription to get into rehab down there. And so I did. Within 3 days of being in Florida, I was in a nice rehab place. Same thing, same pain schedule, medications, everything was the same as the first time. It was beautiful, worked out exactly as the first one. And after that 2.5 weeks of rehab in there in Florida, I was released there. I decided I wanted more. I joined a health club, and we worked out at a health club until we came home from Florida at the end of April. Now, I'm getting back to doing all the things, everything. I may not do them as good as I did 25 years ago, but I'm still doing them. And the thing I love the most that I got back is I couldn't barefoot water ski with the old knees.
So wait a second. You barefoot water ski after 2 brand new knees.
10-4.
Wow. So tell everybody, I mean, how'd that happen?
It's a passion. It's how'd it happen. I hang around with some pretty tough guys up there on Bull Lake, and they work me hard. So I got back to barefooting. It's great. 40 miles an hour on your bare feet, and just yesterday we must have went 1.5 miles, 2 miles on a beautiful water. I love it. I mean, I love it. That's barefooting. Come try it.
Oh, I think I certainly am. And so, Dr. King, you talked about Avatar. The thing right now, people want to talk about, with new knees is, when can I start doing the fun stuff? And narcotics is a big topic right now. The same-day surgical patients, what do you find in their recovery to getting back to their fun activities, and what's your thought on narcotic use?
Well, I think that one of the biggest components that's changed with this has been the pain medication schedule. And we're finding that by using non-narcotic medications in combination, by using different anesthetic techniques, and by using a new injection we call Exparel, which is a long-acting local anesthetic, we're finding people are able to reduce their narcotic use by about 80%. Some patients will come back. We used to give people industrial doses of narcotics. They get 60 pills, they come back in a month, they get 60 more, they come back in a month, get 60 more. We now give people a prescription for 20 pills, and many people will come back and say, I never filled the prescription, or yeah, I took a few of them and that was all I needed. So the less pain is a big part of rapid recovery. And I think what's important to mention is that this really isn't about same-day surgery. That's very important. I mean, these patients are able to go home the same day, not stay over, not go to a rehabilitation facility, but actually go home the same day. And I think it's because we finally have a way to control the pain. We control the pain and the rehabilitation goes much better and goes much faster. And we're finding it a little bit to our surprise. We were kind of surprised when people started coming back at 3 weeks and they looked like they were 3 months out. And I think this has been something that has not been the exception but the rule, that most of these patients come back and have accomplished in 3 weeks what used to take 3 months. And that's really, I think, the key to the program. This is what we're talking about when we talk about rapid recovery.
And I know that we've got at least 2 knees here, but how many of these have you done in total?
Well, we actually started this program more than 20 years ago, but the Avatar program, the real alignment, started about 4 years ago. After a couple of years, we realized that the patients really didn't need to be overnight in the hospital anymore, so we started the same-day surgery just about 2.5 years ago. And if we look at our first 2 years, we did a little over 400 patients, and out of that, 70% went home the same day. And if you look at the rest of the patients, fewer than 10% of those patients, of all of those patients, stayed more than one night, and fewer than 1% actually went to another facility, like a rehab facility. So it has changed the whole program in terms of where patients go afterwards. But I think the most important thing is they really have less pain. They are able to do their rehab and accomplish a great deal more with their rehab much faster.
That's amazing. And Mr. Walfield, I know you got your barefoot friends who are watching us right now. You know, what would you tell people who are thinking about getting the knees? I mean,
this is easy. I've got a slogan, but before we get there, I missed a point. We love to dance, the wife and I. 2 weeks after the second surgery, it was done January 11th. Valentine's Day comes around a month later, okay? We're at a hot Valentine's dance, just cutting up a hell of a rug. It was a dancing is good. The other thing I want to say is the medication. I had a prescription for the first knee surgery, and I had one for the second surgery. Never filled the second surgery pills, medication. That's the amount of medication I needed to get through with pain. Fantastic. Do I have something to say? Yeah. If you can't do what you like to do, if you're starting to hurt, this is what I'm going to tell you. Come here, get her done, and go have fun. You didn't hear me. Come here, get her done, and go have fun.
You know, so we'd really like to thank both Dr. King and Mr. Walfield for joining us this evening on Facebook Live. We have a great opportunity on July 20th at 6 p.m. here at Portsmouth Regional Hospital in Portsmouth, New Hampshire. We're going to actually have a live community event where patients can come in, learn more about your procedures, ask questions. So for more information about Dr. King, about Portsmouth Regional Hospital, please visit our website at portsmouthregionalhospital.com, and we thank you for joining us on Facebook Live.